How you doing? My name is Ashton Dixon, and today for my teaching project, I'll be talking about the top 4 forms of dementia. Dementia is a clinical syndrome characterized by a progressive decline in 2 or more cognitive domains, including memory, language, executive, and visuospatial functions, personality, and behavior, which causes the loss of ability to perform basic activities of daily living. The testing is universal. They use neurological evaluations, brain scans such as CT, MRI, and PET scans. The treatments, there are no cures, but they use certain medications and certain therapies to subside some of the symptoms. And first we have Alzheimer's disease, which is the #1 causing form of dementia, accounting for 60 to 80% of all cases. It first attacks and destroys neurons and their connection to memory. Next, it will affect the cerebral cortex, which controls language, social behavior, and reasoning. The risk factors is age, genetics, hypertension, diabetes, and more. It's a slow and gradual disease, and it worsens over time, with a lifespan up to 4 to 8 years after diagnosis. 2, we have vascular dementia, which is the second most common form of dementia, with 5 to 10% of all cases. It's caused by the lack of blood flow to the brain due to a complete blockage or partial blockage to a clot in the blood vessels. It typically attacks the frontal lobe that deals with the memory, reasoning, and judgment, or wherever the blockage occurs. The risk is stroke, and just like AD, age, genetics, hypertension, diabetes, and more are also a cause. The symptoms is loss of bladder and bowel control, slurred speech, confusion in conversation, and loss in vision in some cases. Third, we have the third most common cause of dementia, which is DLB, which accounts for 7.5% of all cases of dementia. It is also the most misdiagnosed form of dementia. It is commonly mistaken for Parkinson's disease due to the similar symptoms. And what makes this form of dementia different is that it is caused by the buildup of the protein alpha-synuclein, or Lewy bodies. The risk factors is age, sex, which is most common in males, and also genetics. The symptoms is movement disorders, hallucinations, depression, and apathy. DLB doesn't follow a set pattern of stages just like any other form of dementia, like AD does. DLB tends to attack the cerebrum, which deals with thinking, emotion, and movement. Lifespan after diagnosis is up to 5 to 8 years. There are really no treatments for patients because they are mostly highly sensitive to all of the medications, so they do like therapies to deal with the symptoms. Lastly, we have frontal temporal lobe dementia, or FTD. It's the 4th most common cause of dementia, up to 10 to 20% of all cases. It is also considered the most common prenatal dementia, which means it occurs in the younger population. It occurs in the frontal and temporal lobe, which deals with emotion, memory, reasoning, and judgment. The risk factors are smoking, hypertension, diabetes, and obesity. The symptoms is the lack of judgment, loss of inhibition, increasingly bad behavior, and lifespan with frontal temporal lobe dementia is 2 to 10 years after diagnosis. And again, they're all very similar, but all different in their own way. And thank you. My name is Ashton Dixon, and this is the end of my